With the new COVID oral antivirals, being a pharmacist and a medication expert, I was asked to step in to help out with these medications. There are a lot of drug interactions that come with them, and a very specific patient population qualify for these medications. And just because of that further attention to details that's needed for them, I volunteered to step up and help out with it and the education of our providers and our patients.
Paxlovid has been hailed as a potential game changer in the fight against COVID-19. The new antiviral medication reduces the risk of COVID, hospitalization, or death by 89%. Since clinics have limited supplies, high-risk patients are the first to receive them.
For use of these medications, the patient has to start taking them within 5 days of symptom onset and a positive COVID test. So it's very strict parameters of when we can use it. So overall, the equation is symptom onset within 5 days, a positive COVID test, and then a high-risk factor. These medications are not to be used for patients who have a severe COVID illness, so where they are hospitalized or they need supplemental oxygen. This is specifically for patients who have mild to moderate disease that we want to prevent from progressing to severe COVID infection, which would be hospitalization. With our patients who qualify for Paxlovid, some of the resistance that we've received from, do I really need this medication, is that they keep saying that I only have cold-like symptoms, it's pretty mild. The one thing that we don't know with COVID is when it may become severe. It might be after that 5-day window of when we can give Paxlovid. So I've been really encouraging our patients who qualify for it to take it to prevent that severe progression. I've had several anecdotal instances of patients where their spouse had gotten sick, they'd gotten a little bit better, and then COVID came back a little bit beyond that 5-day, maybe that 7-day window, and then they felt really horrible at that point. So I use that as a motivator to, this would be a good reason to take Paxlovid in advance to help curb that and help prevent that progression to severe disease.
While COVID treatments have come a long way since the start of the pandemic, the best prevention is still vaccination.
It's important to be vaccinated because it does prevent serious disease in the individuals as well as spread throughout our community.